Welcome back, everybody. My name is Dr. Khan Kao. I'm an emergency medicine physician, and today I'm joined by my good friend, Dr. Arun Nagaraj. Welcome, Arun.
Hey, Con. Thanks for having me.
Yeah, so Arun and I go way, way, way back. Undergrad. He was actually my roommate in undergrad, and we graduated same major, and we end up going to the same medical school. It was nice catching back up with you. Arun is a neurologist, and so today he'll be talking to us about what it takes to be a neurologist, the life of a neurologist, and whatnot, and any other questions I may have. Arun, to start off, the first question, describe to me your training path to get where you are, and then brief description of neurology.
Yeah. Well, I did a 5-year undergraduate engineering program, and then after that, I went to medical school at University of Cincinnati, and next I completed a residency in neurology along with an internship year initially at the University of North Carolina. So that was 1 year of internship and 3 years of neurology residency. And at that point, I had considered some options and decided I wanted to do general neurology. So I went out into private practice in Cincinnati for 2 years
Hmm.
at a large private practice group, River Hills Neuroscience. And then I decided I wanted to get some more subspecialty training. So I did a fellowship at Ohio State in neurophysiology, which was primarily focused on learning electromyography, EMG, nerve conduction studies,
Hmm.
and to a lesser extent, EEG, electroencephalography. And then my wife and I moved down to Dallas, and I took another private practice job here in Dallas at Texas Neurology, which is a group of 10 neurologists in an urban setting.
Okay, okay. Thinking back to the medical school years,
Yeah.
what made you decide on neurology versus everything else that was available?
Well, initially I was planning on doing internal medicine, but it seemed a little bit bread and butter in that you were seeing the same things day in and day out. And really, what got me into neurology was how fascinating and interesting things were. And I still had a little bit of doubt, but what a major misconception is it's sort of diagnose adios and there aren't good treatments. But the longer I was rotating through the neurology clerkships, the more I was realizing that we're developing good treatments for diseases that we didn't have in the past. So it's just an evolving field and it's fascinating. So that's what got me into it to start with.
Okay, all right, thanks. What kind of personality do you think are a good fit for neurology?
Well, I don't think there's one personality type. And that, just like most fields in medicine, we're seeing a lot of diversity. And um, I think you can be outgoing, you can be introverted and do well in neurology, but you do have to be persistent and you do have to be inquisitive because a lot of things are almost like a mystery. So you have to ask questions, and a lot of times your first theory or hypothesis is incorrect. So you can't get easily discouraged or frustrated.
Okay, okay. And just curious, have you ever considered like neurosurgery, since it's similar, field, but one's a surgical versus the medical aspect?
Well, yeah, I did actually when I was younger. When I was in high school, I thought that would be a really cool field, but I was able to figure out pretty quickly that surgery wasn't really up my alley. I think it's a high stress career with a lot of technical components and mentally and physically challenging. And I knew that wouldn't be something I could excel in. But I did briefly consider neurosurgery, and it's good for neurologists to get into the OR and watch procedures, so you know what's going on inside as well.
Okay, awesome. Thank you for that. Thinking back to your medical school days, would you have done anything differently along this path to get to where you are?
The one thing I wish I had done was rotate more with as many different neurologists as I can. Most institutions have more than one good neurologist, especially University of Cincinnati, and
Mhm.
um, the more people you work with, the more you'll learn and the more you'll get exposed to the different areas in the field. So that's the one regret. I think there's a lot of excellent neurologists, and I only worked with maybe 5 or 10 of them. But um, I think that would be my one thing I would want to change.
Awesome. Yeah, it could be tough because we came from a medical school that has really good neurology program, like one of the best in the nation.
Yeah,
But I mean, for how about for students who are not, they don't have a program at all, or they have to figure out if they're interested in neurology. It could be tough for them.
definitely.
Yeah. So, what do you find that's the most exciting aspect of neurology?
Well, it's almost like a less exciting version of House. It's always a diagnostic mystery. I love the diagnostic mysteries. Those are exciting. I like to send off extensive genetic testing,
Hmm.
um, and um, I really enjoy, when things come back positive and you get an aha moment. That's always exciting. It doesn't happen very often, truthfully, but
Yeah.
that's what really excites me going into work.
Awesome. Awesome. Yeah. Lots of neurological complaints come to ED. I was like,
Yeah,
could,
well, you can come to my office too.
could be MS. I'll send it to Arun.
Yeah, and I always joke with my patients, I'm on the giving and receiving end of, second and third, fourth opinions, and it's just a humbling process.
Yeah. Yeah. For sure. So on the other spectrum, what do you dislike about neurology?
Well, there's 2 or 3 things. Definitely, there's a lot of paperwork,
Mhm.
so I order a lot of tests. Insurance often denies them because they're expensive tests and the indications aren't always strong. So I'm on the phone a lot trying to appeal denials. I'm doing a lot of paperwork, filing prior authorizations, um, and also even just writing work notes, things like that. Um, Signing disability paperwork. It's a necessary part of this career.
Mhm.
Um, and there is a lot of diagnostic uncertainty. We have to accept that the tests we have are only so good. We're only able to explain so much. So you do have to accept that a lot of times you just can't get an answer, and you have to you know admit that another opinion from a different neurologist is in the patient's best interest at times. So those are my two biggest challenges I run across.
Okay. Awesome. Thanks. What are some myths that you think are unfair or untrue about neurologists?
Well, there's this myth that we don't really do very much. I think a lot of doctors are frustrated because we'll see a complicated patient and leave a vague note. And um, it is true that sometimes neurologists are kind of along for the ride in a complicated patient, maybe with heart failure and end stage renal disease,
Hmm.
and altered mental status. But you know, uh, it's not always the case. I mean, there's definitely a lot going on the outpatient side. We're a lot of neurologists, myself not so much, but a lot of neurologists are actively involved in research trials for developing new drugs. And but yeah, one myth is that we don't do very much, and I don't think it's fair. just because,
Yeah.
you know, other doctors who come in contact with us in the hospital, they only get a brief snapshot of our day-to-day experience. Um, I think that would be the main myth that's not accurate, but I understand where it comes from.
Cool. So you talked about a little about working in an urban setting. Can you describe to us any differences if you're working in rural, urban, academic?
Yeah. Well, I'm learning, the nice thing is no matter where you are, you're probably going to get fascinating and interesting patients that come to you. They don't really choose to live in a big city or in the farms, but um, in an urban setting like where I am, I'm often on the receiving end of second, third opinions. I
Hmm.
often have patients drive hours to see me, not necessarily based on my reputation, although I like to think it is, but more because they can't get in to see a neurologist out there because the wait list is so long. So, I think um, there is an expectation that you can offer a little bit more services and expertise in an urban setting, maybe, but that doesn't have to mean that you can't get the same high level of care anywhere, even out in a rural setting as well.
Okay, awesome. Thanks. How has neurology shaped your work-life balance, or if you can describe to me a general work-life balance of a neurologist?
Yeah. Well, I'm pretty much an 8 to 5 kind of guy.
Mhm.
So there are exceptions. I do take a little bit of call in the hospital on, maybe 4 or 5 weekends a year. Um, Also, you know, I do get phone calls. I do take outpatient call. So
Mhm.
occasionally I'll get woken up in the middle of the night with something, but not often. And for those really sick, difficult patients, I give them my cell phone number and they'll call me. I don't do it often, but it just works out the best for some settings.
Mhm.
So, I mean, I like to think that once I get home at 5:30, 6, I'm done with work. Um, that's not always the case. I mean, there
Mhm.
are exceptions, but I would say most of the time I'm able to kind of shut out work when I come home.
Okay.
But you're always thinking about it, and it's not perfect, but it's definitely better than it could be in other settings. And I'm more of an outpatient doctor.
Mhm.
There are, of course, more higher acuity avenues in neurology where you're not going to be able to work 8 to 5, and you're going to get called in to see a stroke or um, you know um, maybe even uh, do endovascular treatments for strokes and things like that. So it just depends on how you tailor your career.
Okay. Does the scheduling for inpatient neurologists differ a lot then for outpatient?
Yeah. So I feel like the shift these days with inpatient, they're switching more to like a 7 on, 7 off schedule for a lot of people. A lot of people like that, being on when they're on and off when they're off. But
Hmm.
when you're on, it's busy, and you're going to get called in most settings. But It's hard to really have an 8 to 5 lifestyle if you're doing inpatient work in a hospital.
Hmm.
But If you're doing 7 on, 7 off, you compensate by not having to work half the time.
Okay, awesome. Thank you for that. Can you describe to me like some of the major changes that's happened with neurology over the years, and then discuss in light of new changes with COVID-19, or and also a like an outlook in 10 to 20 years?
Yeah, those are good questions. So the biggest change I saw take shape almost instantly after I graduated from residency was the onset of endovascular clot retrieval
Hmm.
for large vessel occlusions and ischemic stroke. So certainly endovascular treatments for emergencies with acute ischemic stroke, that's really taken off, and it's been really phenomenal. To to watch patients come in and not be able to move one side of their body and then walk out of the hospital 2 days later after getting a clot retrieval, that's really been phenomenal. So that's been a huge advancement for the patients who can benefit from that. Um, I think another thing that's in the pipeline that we're going to see is a lot of gene therapies. So not directly in the areas I'm in, but certainly we've seen some really encouraging results from gene therapies for spinal muscular atrophy, um, a disease that was essentially untreatable until recently. And also, my area is more MS, multiple sclerosis, and there's really been an explosion in the amount of new immunomodulatory, immunosuppressive therapies and the amount of options that are on the table.
Hmm.
So things are certainly improving with better treatments. Um, and then let's see. The second question was how things are evolving with COVID. Is that right?
Yeah, yeah, yeah. If there's any changes with the field at all.
Yeah. So what I'm directly encountering, I have a lot of patients on moderately aggressive immunosuppressive treatments for multiple sclerosis. So naturally, everyone's concerned that they might get COVID and their risk is increased because of these treatments. We are doing more telemedicine, um, but unfortunately, we as neurologists we have a vulnerable population, and we can only hope that this pandemic passes in a
Yeah.
timely manner.
You touch upon teleneurology. Do you feel like that's a increasing trend for the future as well?
Definitely, I think we're going to rely on that a lot. You're going to have patients who live 2, 3 hours away, and they're just going to want to do it. And you're going to have patients who can't come in because they're too weak, or um, even people who live close by who find it convenient and don't want to expose themselves to the face-to-face risk of COVID. So it's definitely going to be a part, and it's here to stay. But we have to accept the limitations.
Mhm.
Internet connections fail. Um, you can't figure out what's going on without examining the patient a lot of times, and it's still difficult to get an accurate history when perhaps the patient's caregiver isn't with them or is inaccessible.
Mhm.
I mean, I think telemedicine works and it's good, but sometimes there's no substitute for face-to-face encounters. So we have to figure out, and we still are trying to determine where is the best setting to do a telemedicine appointment, and where can we compromise and do that, or where do you absolutely need a face-to-face encounter and put a patient, through the risk of getting COVID from
Mhm.
and through the burden of traveling.
Mhm.
And we're all still trying to answer that question, I think.
Okay, awesome. Thank you for that. So, do you work with mid levels like nurse practitioners or physicians assistants? And do you think that their responsibilities will change over the years?
Yes, I do work with mid-levels and um, I work directly with them mostly in the hospital. So the way we're structured is they'll pretty much run all the follow-up patients.
Hmm.
So they're familiar with all the follow-up patients, and I'm kind of seeing the new patients, and they're functioning very independently, and they are um, able to ask me questions and ask for help, but it wouldn't really be a feasible system without them. There's just too many patients to see and not enough doctors. So it's been a really good addition to the field. Um, and I think that in the future we're just going to have more nurse practitioners, and they're going to be you know functioning more independently. And I think I've been lucky that the ones I've been around, they are well trained and they do know when and how to ask for help. Um, and it's just been a needed addition to the field of neurology.
Okay. How do you think the job market will be in 10 or 20 years from now?
Well, I think it seems to be getting a little bit tougher for people who want to do what I'm doing, kind of do the 8 to 5 outpatient lifestyle. Everybody kind of wants to get home and
Hmm.
be done with work. And I think there's going to be more and more demand for outpatient and less for inpatient. As we're going to see more strokes. There's going to always be a demand for inpatient
Hmm.
neurology, but I think less and less young doctors want to do it. Nobody likes going in the middle of the night and deciding if you're going to give TPA or, um, getting paged multiple times in the night with new consults. It's a tough lifestyle, but I think it is getting a little tougher. But it's just one of those things. It comes and goes, and there's always going to be headaches and dementia and neurological problems. It's just I think the demand is higher in rural settings where there's more patients and fewer doctors, and I hope that we'll be able to get more young, capable doctors out there.
Okay. Um, okay. Thanks for that. You may not want to answer the questions, but do you feel that the increasing independence of mid-levels will decrease market demand for neurologists?
That's a good question. It could. We've seen it happen in other fields. I don't think it's quite got there yet for neurologists. I think it could. I mean, there's definitely some higher levels of expertise that MDs are going to always have because they've completed much more training and had more experience. But um, I think I think that is going to happen. I think um, the more mid levels we have out there who are functioning independently, there might be a little bit less demand for neurologists to see the very bread and butter things, migraines, dementia, Alzheimer's, the things that a mid-level has seen hundreds of times and can handle. So
Mhm.
it probably will happen, is my guess, but I don't know that for sure.
Okay, awesome. Thank you. And then um, where can students look for to learn more about neurology if they're interested in?
Well, I think the best place to start would be to talk to your neurology clerkship director, and don't stop there. You know, the people you want to seek out are the doctors who are actively involved in teaching other people. So clerkship directors, fellowship directors, those are good people. And the AAN, American Academy of Neurology, has a lot of great resources. Um, for people like me, they have mentorship programs where you can get paired with an older physician. And I wouldn't be surprised if they have that for students as well, where you can get paired with someone who can mentor you through the process. Um, but I think the best place to start would be just getting FaceTime with as many different neurologists at your medical school as you can, to learn about the field.
Okay, awesome. Thank you, Arun. And lastly, what are your top tips to students who want to go into neurology or medicine in general?
Well, I would say don't give up. That there's always going to be a bad day. There's always going to be a bad outcome that may or may not have been within your control, and you can't get discouraged by it. You have to learn from the mistakes, or um, if there were no mistakes that you made, you just have to kind of pick yourself up and go on to the next patient. And I would just say, um, keep your eyes and ears open because everything's changing around us. And the more you read, the more you listen to other people, going to conferences, I think you're going to learn more and be in a better situation to treat your patients down the road.
Okay, awesome. Thank you, Arun. And then, do you have anything else to add regarding neurology that I may have missed or haven't asked?
Well, I'd just like to let people know it's a great time to be a neurologist. It's just such a great field. There's so many different areas, and you can tailor it to your interests. If you like high acuity settings, you can do neurocritical care or endovascular stroke treatments. If you like outpatient work, you can do dementia, multiple sclerosis, those neuromuscular disorders. And there's just so many new treatments that are in the pipelines, and we're going to need a lot of bright young doctors who are well versed in those. And I think this is a great time to go into neurology. Don't focus too much on lifestyle or compensation. Focus more on what you enjoy doing and what you want to do, and then once you figure that out, you can, you know, meld out your career paths to meet your needs.
Awesome. Thank you for that tip. All right. I appreciate Arun for taking your time. I mean, you have a wife and kids and family there during these times of COVID to take care of. So I appreciate you taking time out to have a chat with me for this.
Oh, I'm happy to do it. Thanks for having me, and I had fun talking with you, catching up, and I hope I can convince someone to become a neurologist.
I'm sure you'll be able to. All right. Thank you again.
All right, thank you, Con.